Cases of children being hospitalized with the flu are on the rise, and the flu season won't even peak until about February. RTV6 reporter Tanya Spencer looks at the recent spike and the vaccine supply here.
True influenza is the sudden onset of high fever, usually with sore throat, dry cough, muscle aches, headaches. We've certainly seen an increase in the number of cases in the last few weeks that are getting reported out.
Not only have there been more flu cases reported over the last few weeks, according to the CDC, more children have been hospitalized because of it across the country. Dr. Christopher Belcher, the director of pediatric infectious diseases, says nearly a half dozen children have been hospitalized recently at Peyton Manning Children's Hospital because of the flu.
We've recognized for a long time that the elderly were at very high risk of hospitalization and death due to influenza. It turns out that the young children, the infants, are at the same risk of hospitalization as the elderly are. So it's important that both groups get it, but it is important that everyone receives their influenza vaccine.
With more manufacturers this year, there's plenty of supply of both shots and flu mist. And since the flu doesn't typically peak until February, Dr. Belcher says we're likely to see more spikes in flu cases before flu season is over.
Yeah, there's really no such thing as too early or too late for a flu vaccine. And even sometimes when we've had a peak of influenza virus, there's a second peak. Either another strain comes around, and since the vaccines have 3 or 4 strains in them, it's often worthwhile to go ahead and get that flu vaccine regardless of where you are in the season.
Meanwhile, we should all work to prevent the spread of the virus.
The best advice is what your mother told you to do. Wash your hands frequently. Avoid touching your eyes or nose. And if you have to cough, cough into your elbow. Reporting at Peyton Manning Children's Hospital, Tanya Spencer, RTV6.
This was the first year that some manufacturers added a 4th strain to the vaccine. All manufacturers will likely follow suit within the next couple of years. There's also plenty of flu mist available, which actually seems to work better for young children.